give the inaugural address to Dr. Shalini Rajneesh.
Morning, everybody. At the outset, let me thank IGNO for taking up Karnataka as the host for this Southern Region Bridge Course launch and give me the opportunity to be here with you and be part of this very important activity of empowering our nurses. If engineer would say that foundation is the building blocks and how important it is, I'm sure nurses are our biggest foundation and strongest foundation of the healthcare service. And if they are strong, if they are having that confidence that yes, we will be able to come up to the expectations of the people as far as healthcare services are concerned, I'm sure the rest of the umbrella of services would be certainly in tune with expectations. Regarding the training, normally they say that you can take a horse to water, but cannot make it drink. But for the counselors, training counselors, I would say you have to make them drink. For making them drink, the thirst has to be there, or the water should be so sweet and attractive that they feel like drinking. So that's where the challenge today lies in ensuring that these courses become realistically useful to the target group that we are proposing. The universal health coverage is the most important program today of the health department under the leadership of our Honorable Minister and Chief Minister. Probably Karnataka would be the first state to roll out universal health coverage in India with the support of Government of India, Ministry of Health. There are a couple of challenges we find. The biggest challenge is that we do not get the specialists in the numbers that we want. And even general medical officers in the remote villages. After getting an MBBS degree, they don't feel it is up to their dignity to go and work in a village. They must work only in metropolitan or at least in city headquarters. Unfortunately, the largest number of people are in rural areas, and that's where they are needed. There's a mismatch, yet how do we fill it up? We fill it up with our paramedics, our staff nurses and staff, and health workers. However, if they are not confident in giving the healthcare services, despite all the courses and training that they have, then this dream may not become a reality. So what is it that we need to do? We need to somehow fill in that confidence in the minds of our nurses and health workers that you are the most important bridge between a household and a healthcare service, be it a sub-center or a PSC or a hospital. In fact, the target is not to get people to hospitals, to ensure that they are hale and hearty in their own households. And for that, it's not just modern medicine alone, but many of the traditional health practices, lifestyles, and good, healthy lifestyle issues that we need to sensitize the people about. But for that, they should be first aware. They should first be convinced that yes, if I do such and such a thing, I can prevent diseases. Once he or she is convinced, they can then forward that same information to the households. And in the households, it's the women who are the biggest clients, customers. If we are able to pass it on to the women, it goes on to the entire family in a very, very smooth and palatable way. I personally feel that at present, our staff nurses are much is to be desired. They are not confident. In fact, recently, day before, I was in Kurg, in one of the PHCs, remote PHCs, where there is no doctor. And I asked that staff nurse, it's a beautiful PHC, huge. Everything, you have this room, this equipment, that equipment, laboratory technician, everybody is there. No patient, no person, no deliveries, no activity. What is the use? Crores of rupees being spent, but to no avail. And I asked her, what is it? You know that from time immemorial, it's the Dais who used to do deliveries. She says, last month, madam, I conducted one delivery in a population of 10 to 15,000. So where are they going? Yes, madam, we send them by 108 to the nearest hospital. I said, what if something happens on the way? It is a very critical stage in which pregnant women are being taken. Madam, I'm too scared. What if something happens? I said, something may happen in a high-risk case, I understand. You can't handle. But some 85% of the cases are normal deliveries. At least that you should be able to. From next month onwards, I will show results, she said. No, it's just that somewhere we have to talk it out with these people. Bring that inner strength in them, saying that yes, you can do it. And if you have some reasonable or genuine concerns, we should be able to address it. Why I am saying this is that the training cannot be just one way. It should be two-way. We must also get a feedback from them as to what are their constraints. Why is it that they are not able to deliver what they should have delivered? And as a result, our outcomes speak for it. If we are having higher infant mortality or higher maternal mortality, something is not alright. It's not the way it should be there. Therefore, why madam mentioned about the training need analysis. You need to know what is it that they require. You might have created a standard course, material, everything. Yes, fine. But every place may have a different requirement. Therefore, I know the way IGNOU works, it's a very, very flexible and a very need-based, very practical kind of a training. That is why it is appreciated so much. The same is what I expect from my trainers in the villages, particularly the two pilot we have taken in Raichur and Tirasapur. We want to create this as a model. We want to create the model in terms of the wellness center. So away from diseases, away from that hospital kind of a culture, we want wellness to flourish. And therefore the bottom line should be wellness. And we must reiterate what are the principles of wellness. With that, there should be high index of community participation. Wellness cannot happen in standalone isolation. It has to be community participation based in that all other departments' convergence is also as important. Therefore, one of the very important training that has to, or attitudinal orientation that we need to give to our nurses is that work with the people, work with other departments, and not just, I'm a nurse, I do this much only. No. Expand your, as we say, universalize health coverage, same way, universalize your activities, be open to the issues like sanitation or drinking water, safe drinking water, or even social practices sometimes which are so inhibitive and so detrimental to the health and wellness scenario. And therefore, in a comprehensive sense, if we are able to make them feel that yes, you are now in charge, and your indicator is that nobody should unnecessarily be brought to the hospital. Unless absolutely necessary, they should not be brought to the hospital. So our lesser number of figures should be the indicator of higher success. And I am very sure with the dedicated team that we have in Karnataka, in IGNOU, and all other stakeholders in the project team, this shall become a model for the rest of the country or maybe globe to follow, and we will all be proud of each other and ourselves. Thank you very much and wish you great success.